Warm welcome to you. You might have just been a few minutes ago in the lightning chat, and here we are again, but this time to talk about integration and lifelong immunization. So we're here with Laura Nick-Laughlin and her colleague from the U.S. Centers for Disease Control, Erin Wallace. Welcome to both of you. I'm going to hand it over to Charlotte Mbou to kick off with the questions. This is rapid fire Q&A. We go for 15 minutes unless you as participants ask more questions, and then we keep going for a little bit longer. Charlotte, how are you doing?
I'm doing great, Breda. Thank you very much. And warm welcome to you, Laura and Erin. Great to have you with us here today. And so we are going to go straight into our questions, talking on integration of immunization with other health services. So please, can you kindly introduce yourself? Tell us who you are, where you work, and what you do. So we are going to start with you, Laura, and then Erin.
Thank you, Charlotte, and hello to everybody. My name is Laura Nick-Laughlin. I work at the WHO headquarters here in Geneva, and I work on life course and integration, as well as missed opportunities for vaccination and also home-based records. So over the course of these lightning chats, you'll be hearing from me about all those different areas. So over to you, Erin.
Thanks, Laura. My name is Erin Wallace. I'm with U.S. Centers for Disease Control and Prevention in the Global Immunization Division and the team lead for our Immunization Delivery Science team. We do quite a bit of work around implementation research regarding integrated delivery of vaccinations, as well as the life course approach to vaccination as well.
Thank you very much, Erin. And so we'll start with the basics. What is integration, and why is it growing in importance for immunization programs? I think we'll start with you, Laura, and you may want to invite Erin if you think he should add something to the subject matter. So, okay. Laura?
Great, thanks. Thanks, Charlotte. So I think integration, it's not a straightforward, we don't have a straightforward definition of it. But what we think, when we think about integration, we think about packages or packages of interventions that we can provide across the life course, or at different type of delivery points. So when we think about integration, we can think about for immunization. When people go for immunization, they not only receive immunization, but they sometimes receive growth monitoring services, or they receive vitamin A, or deworming, or bed nets. So what we're trying to encompass or achieve through integration is by making good use of every health contact, whereby when we have people accessing services, that they receive all the necessary interventions that they're due. And I think that's why many times in many countries, we see that this is working quite well, but in other countries, we're trying to see how they can improve and make things better. And WHO has a technical brief that describes the 6 main uses of the term integration, and it's quite broad, but it means either working across sectors or trying to ensure that there are policies in place that ensure that there's planning and management that can happen at different levels. But as you probably know, for many of you that work in immunization, sometimes we work in very vertical ways. We don't work as well together as we should across other areas. So what we're trying to encompass with integration is see how we can work together better and see how we can try and increase coverage of not only immunization, but also other health interventions. And in terms of why it's growing in interest, I'll hand that over to Erin to answer that.
Thanks, Laura. So one of the reasons why it's growing so high in interest is around the desire to be able to optimize the use of fairly limited resources that come in for supporting health systems. And the desire there is there's opportunities to put together various packages of services like what Laura was describing that can be distributed in a fairly efficient fashion in these integrated opportunities as caregivers and individuals come in for their various health visits. There's also a strong desire for being able to continue a push towards a primary healthcare approach. And this is something that's very much highlighted in the IA 2030, the new global immunization agenda around universal healthcare coverage. And integration is a huge strategy that underlies the universal healthcare goal.
Okay, so thank you very much, Laura and Aaron. So talking about the Immunization Agenda 2030, we know that one of the 7 strategic priorities is life course and integration. What can you tell us about the life course approach to integration?
So the life course approach integration, it's and also this relates to, I suppose, the definition is about having a continuum of care. It's where you think about care across the life course, and how at each different time point in an individual's life stage that they can obtain specific interventions that are necessary and useful for them. So that's why, as part of Immunization Agenda 2030, what we're hoping to see is that over the coming years that we will see more opportunities for vaccinations to be provided to both infants, children, adolescents, adults and older adults. Because what we see in many countries is that, for example, many countries don't have the second dose of measles. So it can mean that for a young male at 9 months of age, when they receive their measles dose, their first dose, they may not receive another vaccine for the rest of their life. But really, there are other opportunities, such as booster doses for DTP, and then potentially some countries are going to offer HPV vaccination to both boys and girls. And then in adulthood, there's also other opportunities for influenza vaccination and other immunizations, but also not just thinking with the immunization lens, but if we want to integrate, where could these vaccines be delivered? Could they be delivered in a different service delivery site rather than at a health facility? Or are there also other interventions that could be offered to that individual when they do try to access services for specific vaccines or other health interventions? So I think that's really where the idea of life course vaccination and integration is trying to encompass ways in which we can think about a continuum of care, whereby we offer care to people across the life course, but also ensure that we can, from a coverage and equity point of view, that those who are due and eligible for those interventions receive them, and they have the opportunities to receive them. Aaron, do you want to add anything further to that?
I'll just highlight that one of the big pushes with the life course approach to vaccinations is with many of the newer vaccines targeting older age groups, that the idea here is that you are recognizing that individuals already are receiving many health and related services throughout their life course, and vaccination has an opportunity now to integrate into those existing visits and utilize those as a more efficient manner for providing these newer vaccinations for the older age groups. And so it's, again, kind of going that idea of being efficient, making the vaccinations convenient and accessible with use of existing contact points.
Okay. So, for example, given the current context, what we know is that with the introduction of COVID-19 vaccination, that this is the first time we have a vaccine that's going to be given to quite a wide cohort, quite wide age range of the population. And in many countries, there's no established contact points or platform for delivery of vaccines to certain age groups. But we do know that many, particularly older adults, are accessing our services for non-communicable diseases. So potentially for high blood pressure or diabetes or other ailments that they may have. So we know that there is established platforms for receipt of those type of interventions. So how can immunization build on top of that and try and ensure that while that individual is receiving those health interventions, they may also have the opportunity to receive immunization. So I think that's the idea, is that we want to try and think more strategically rather than having these parallel and vertical structures, to try and see how we can combine these instead and make use of people's time, because we know that if you go for one intervention visit one day and then you have to go back another day for something else, wouldn't it be better if you just got them all on the one visit? So I suppose that's the idea. It's trying to make things more efficient.
Okay, thank you, Laura and Aaron. And talking about this, just brought the COVID-19 pandemic to my mind, where there has been drastic changes in health service delivery. So what impact has this had, or could this have, on integration of immunization with other health services?
Aaron,
so
do you want to give that a go?
You, Aaron?
Sure, I'll give that a shot. Yeah, and I think Laura really touched on a key component to this with the COVID-19 vaccine and the opportunities there for integration. One of the other pieces to highlight with the pandemic is that there's known disruptions to all essential health services, and that we really have to look beyond the vaccination silo and recognize that all essential health services for individuals have been affected fairly equally, and there's massive inequities that have now been introduced that really have been brought about by the pandemic. And it's really critical of us to look beyond just strengthening or supporting the issues around disruption to immunization services, that we are also supporting the challenges that have disrupted all essential health services. And that when we're going in and we're addressing strategies to catch children up on vaccination, that we're also recognizing that this should be an opportunity in such a catch-up type of strategy, that we're also addressing nutrition, growth monitoring, and related health interventions for these individuals. And this is where we are seeing an opportunity around the integration angle as well, but it's also something that we could miss too, and we have to be very cognizant of that and recognize that this could be a situation as well where if we don't think with an integration lens, then we may leave behind certain essential health interventions that may have less resources behind them compared to immunization. So it behooves us as an immunization community to recognize that and take advantage of these opportunities for integration as we address these COVID-19 disruptions to essential health services.
Thank you, Aaron. And Laura, we have some folks who've been piling on the messages online. So I just want to take a few seconds to mark a pause to greet Amel El-Tahir from the Kingdom of Saudi Arabia, Irinde Margaret, who's an IPC expert from Africa CDC in Lagos, Dr. Taimur Kayani, who actually has a first comment. He says, integration of health service delivery is a core requirement to improve immunization. Now, Busta and Kulu just says hello. Elena Cotelo is connecting from Uruguay and says hello. Dr. Iwat Ndayo from Nigeria, Subashri Das, who says good evening everyone, Emmanuel Musa from Kaduna, Caroline Akosile also from Nigeria, and then we have one more scholar from Nigeria, Erdman Amos. I'm going to stop here and go back to Charlotte.
Thank you very much, Reda. And my next question, you have kind of like addressed the first part of it through previous comments. You say, what are the various health services that could provide immunization services or referrals? And the second part is there any particular way in which these services should be organized in a health facility? So, Laura, could you throw more light to that in addition to what you have said previously?
Okay, thanks. I think for those of you who were here last week for the Missed Opportunities for Vaccination lightning chat, I think this kind of links a little bit into what we see happening regularly, whereby people who come for other health interventions who are eligible for vaccination sometimes leave the health facility without receiving the vaccines and services that they're due. So I think the way in which we can try and ensure that integration is better incorporated into health facility level, and also not just at health facility level, but also at national level, there are policies in place so that it allows for people who come for other services to receive vaccines or to be referred for vaccines. That's the main thing. And I think ensuring that that this can happen means that there needs to be well-organized structures in place at the health facility level whereby people can ensure that when they do come, that there's available supplies, that health workers are trained to deliver multiple interventions, that people are aware of when these interventions are available on a specific day, or if it's not possible to have these available every day. And I think from an immunization perspective, I know that in the past we have recommended that the main thing is that you screen a child's vaccination card or home-based record at every health contact. And as part of the integrated management of childhood illnesses, this is meant to be happening in many countries anyway, but we know unfortunately that it's not. But I think that ensuring that there are these type of policies in place and that they're implemented correctly, this can really help with ensuring that we can deliver a wide spectrum of interventions that are really important and essential for not just children, but also for mothers and just the communities in general. So that's why we advocate for ensuring that policies are in place, that screening and referral occurs, and that services and supply are readily available, because we know that if we ask someone to come on a specific day and there isn't supply available, then the likelihood of that person returning goes down, and we don't want that to happen.
Thank you very much, Laura. And for those who are with us here in the Zoom studio, you could raise your hand if you have a question or comment, or just type in the chat, and I'll be delighted to read them out to our guests for today. So my next question, I'll start with you, Aaron. Well, because you are being viewed now by so many immunization professionals, and for those who can see the benefits of integration of immunization with other services where they work, what are practical ways that they can learn more about integration to use the best available evidence in their place of work?
Yeah, that's a great question, Charlotte. WHO has put together an excellent guide on strategies for integrating immunization services with other essential health and development services. And in that guide, it lays out a number of practical ways in which healthcare providers and district and subnational and national immunization managers can approach the topic of integration, whether it's integrated delivery of health services, or it's more around the approach of having stronger collaborations with other health and development partners. There's also guidance around other types of approaches for integration as well. So for instance, school-based activities for vaccination is another aspect as well that WHO has put together excellent guidance. And Laura has also touched on the missed opportunities for vaccination topic as well. And that is certainly an aspect of the integration and life course approach too. So WHO's immunization website provides an excellent set of resources for practical ways in which to learn more about the evidence around integration.
Okay, thank you very much, Aaron. Reda, any comments from our Facebook, our audience on Facebook?
So there's a very lively messages. Two comments. One is from Ndayo Iwat. Ndayo says, yes, primary healthcare scheme approach that promotes equity, intersectoral collaboration, and community participation is the way to go, he says, for life course operations for results. And then Dr. Taimur Kayani from Pakistan says it's all about the 3 A's: accessibility, availability, and affordability. So that's what we have that stands out from the various platforms. And of course, Charlotte, I believe you have one last question, but the principle of the Lightning Chat is that it is for the participants who are here with us in our Zoom studio to raise your hands, and so we can hear your questions and comments and reflections. Back to you, Charlotte.
Thank you, Reda. And there is an interesting comment on the chat here before I look at my last question from Aisha Kadai that says integration of immunization with other health services is the best. so that all health workers will have one voice and a focused goal, because the community will always want to hear more about the vaccine from a health professional. So I'm going to turn towards you, Laura, and then Aaron with my last question. How is immunization different in 2030 if the goals of life course and integration are achieved? What will make the difference to achieve these goals?
It's a great question, I have to say. And I think the main thing that I would hope would be achieved by 2030 is that we close the gap on those that are unimmunized, or under-immunized. So by ensuring that those who access our health facilities, that they receive every opportunity possible to receive all the due and eligible vaccines that they can. By doing so, I think we can really try and close the gap. We know that for the past 5-10 years that coverage for the third dose of DTP has been the same, but we also know that we're vaccinating more people than ever. So this is the challenge we have is, are we doing better or do we need to do better? But I think that if we can try and make sure that those who are accessing our health services and receive the doses that they're due, that we can try and close that gap a bit more. And I just also wanted to kind of touch on another point, another aspect, because we're talking a lot about health facility-based delivery of vaccines, but outside of the health facility, we have many countries that have campaigns occurring on a regular basis, and these are done in very different stages across the year. We may have a polio campaign happening in 1 month, and then the next month it could be a measles campaign, or it could be another vitamin A campaign happening a couple of months later. So also to try and think about how we can integrate also at the campaign delivery level, that's also another area that we hope will advance over the next decade. And potentially, realistically, or maybe this is being unrealistic, but by 2030, maybe we will have less campaigns occurring and more delivery at the primary healthcare level, so that we can ensure that people are regularly accessing services, and then we don't try and we're not reliant as much on campaigns to try and address potential future outbreaks. So that's kind of where I would hope we would see things by 2030.
Okay, Aaron, what about you?
The key approach with the new immunization agenda for 2030 around life course and integration is that it's a big value around it is that it's people-centered, and the integration approach is at the heart of it a people-centered approach, that you're providing the services that the community has desire for, and that you're doing it in a fashion that is the most convenient and accessible for them. And a piece around this in terms of continuing to strengthen coverage of all essential health services is also increasing levels of satisfaction that the community has for the services that they're receiving. And a big part of that is that you're not just providing one service, you're providing this package of essential health services. And so one thing that I would hope to see achieved is that you're also able to combine this level of high coverage for essential health services with also high levels of satisfaction with the quality of the services that individuals are receiving from their healthcare system.
Okay, yes, Laura, go ahead.
Just to touch on the point that Aaron's made a very good point about this people-centered approach. And a lot of people think that on paper integration is the solution to many things, but there are risks and benefits. And ensuring that people are happy with the package of interventions that you're providing is key. Because if you try to offer certain interventions that people don't want, then they may not want to access your services as a result of that. So that's why there's a lot of considerations that need to be taken into place and taken into account before trying to integrate certain interventions. And that has been outlined in the Working Together guide that is one of the resources for part of this lightning chat.
Thank you very much, Aaron Wallace, Laura Nicola-Klein, and Charlotte Mbu. Now, I urge you, if you'd like to go further all you need to do is to go to immunizationagenda2030.org, and you can see right here under the strategic priorities what we've been discussing is life course and integration. You can download what the immunization agenda says about life course and integration, but even more importantly, you can think about what this means for you in your context. So we're going to put a pause here, but the lightning chat is really just a conversation starter. If you'd like to know more, there is of course the IA 2030 course and many other opportunities that will be coming your way via the secret IA 2030 Telegram channel, as well as the more official email and other channels. Once again, thank you for having joined us. Look forward to look out for more lightning chats. Sometimes we announce these with very short notice, and see you soon.